This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Delighted you're with us today. And you know, it's flu season, so we want to talk a little bit about the flu. And we've got Dr. Shawn Riley with us today. He's the Regional Medical Director at CareNow Urgent Care, which, as you know, is part of Medical City Health. Dr. Riley, welcome to the show.
Thank you very much for having me here, Steve.
Dr. Riley, would you say we're beginning to see an uptick in flu cases in North Texas?
Yes, absolutely. You know, when we monitor for the flu here in North Texas, we look at a bigger picture. We look at not what's just happening here in our own neck of the woods, so to speak, in the Dallas-Fort Worth Metroplex, but we take a look at what's happening around the nation and around the world as well. The CDC flu surveillance, which runs about 2 weeks behind, has noted a national uptick, with Texas reporting a particularly high influenza-like illnesses, followed by Georgia, which was about a couple of weeks ago. But a little more recent and specific data from the Texas Department of Health and Human Services notes there's been about a 30% increase week after week of positive flu tests in Texas and here in Dallas. And then here within our own clinic system in the Dallas-Fort Worth area, we actually had a 288% increase week over week in flu diagnoses in our own clinics.
You know, I was talking to an emergency room doctor this week, and he told me, things are changing. He said, Steve, I've been treating patients with flu in June, July, August. He said it's been all over the board. It just hasn't been that traditional flu season. Would you say that's what you're seeing? And what is the traditional flu season?
Yeah, absolutely. It has been a little bit different this year. Usually we see the flu season in the United States start up in about November, generally peaks in about January or February, and kind of peters out around March or April. Now, this one is particularly different. You can see that we've already started off with our flu season this year. And although flu seasons can be notoriously difficult to predict, as I mentioned earlier, we generally look to the southern hemisphere to kind of know what might be happening to us in the future, because once again, their winter is our summer. When we take a look at Australia, for example, their flu season started particularly early, which was early to mid-October. Once again, about 6 weeks earlier than what we would normally see, and we're starting to mirror that here as well.
When you think in terms of the flu and you want to do everything, obviously, you can to prevent it, who do you recommend should receive a flu vaccine?
Yeah, absolutely. Anybody that's 6 months of age and older, with some very rare exceptions, should receive the flu vaccine. In fact, I would recommend that everybody who's listening to this program actually get it now, because we're starting in the middle of the flu season, and it generally takes about 2 weeks for your body to build up an immune response, the antibodies, to help keep you from catching the flu. And really, it's indicated for nearly everybody 6 months and older.
So, you think in terms of the vaccine, you can get a shot, but there's also flu mist. Can you explain to our listeners, what is flu mist?
So the flu mist is a nasal spray. It's a form of mucosal vaccination, which means that it's not injected into the body like the more conventional flu vaccine is, but rather it's sprayed into the nose or into the mucosal surfaces. Now, this particular type of vaccination method is not for everybody. At this time, the flu mist is only indicated for those who are 2 years to 49 years of age, not pregnant, and not immunocompromised. Whereas that the injectable version is good for anybody that 6 months is up, without rare exceptions. And of course, we do offer the injectable version at CareNow.
You hear a lot about get a flu vaccination, and many people, would go to like a CareNow, or people would go to their pharmacist and get a flu shot. Do people at a pharmacy, a retail pharmacy, do they generally administer flu mist?
So the flu mist is not available at all locations. For somebody that is more interested in getting a less invasive types of vaccination, sometimes because needles can be a little bit scary, even though they're small, you would have to call ahead and find out which pharmacies have it, but it's not generally available.
You mentioned flu mist isn't for everyone, and I think you said in your answer over age 2 and under age 49. Is that correct?
Yes, sir.
So do you know why they would not give it to someone 55 years old?
Yeah, absolutely. So the flu mist is actually a different form of the vaccine. So it's a live attenuated virus. And in non-medical terms, what that means is that it's let's say, a debilitated form of the virus, one that doesn't cause the usual form of the disease if you got exposed to it. But being a live vaccine also means that people who have a compromised immune system, somebody that doesn't fight off infections very well, could actually get quite sick, almost as bad as having the flu. So therefore, it's not really indicated for people outside of that age group and people who have those other immunological conditions.
Well, thank you for that answer. That certainly explains, as you get older, over age 49, why you wouldn't get it. Let me ask you this, though. Of the people that do get the flu shot or the flu mist and they're eligible for it, is the efficacy about the same?
Yes, absolutely. So the main differences between the flu mist or a mucosal vaccination and that of a injectable or systemic form is that the mucosal actually is a little bit more robust in terms of the local antibody reaction. And so if you think about it, what's generally floating in front of your nose in the air is pretty soon going to be inside your nose because we breathe it in. Now, our respiratory tract is really good at eliminating the things that we breathe in. We have the hairs in our nose. We have teeny tiny hairs called cilia. But most importantly, we also have a lot of mucus. And so this mucus secretion, which coats the inside of the airways, traps and sticks particulate matter that happens to be floating in the air that we breathe. That mucus also contains something called IgA, which is an antibody. And that's the one that fights off infections right where they start, is before they enter the body. Now, that being said, although the flu mist, the nasal spray, elicits a better reaction when it comes to where the virus enters the body, the intramuscular injection, which is the conventional needle-type vaccination, promotes a more robust systemic response. And one of the things we worry about with the flu is the type of comorbidities that a person has that could lead them to have a bad outcome or a complication of the flu. The most dreaded complication being pneumonia. And of course, an infection of the lungs, which is a major organ in the human body, requires that the systemic part of your immune system, that other compartment, fights it off much better.
We're listening to Dr. Shawn Riley, who is the medical director at CareNow Urgent Care across the Metroplex. Obviously, it's cold and flu season. Whether you go to CareNow or your physician or pharmacy, we always recommend that you talk to your medical team about the decision to get any medical procedure, including the flu shot. When we come back, Dr. Riley is going to answer why they have to guess, if you will, at each year's flu shot and why he believes this year they have an advantage. That's next on the Human Side of Healthcare.
This is the Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're going to jump right back into our conversation with Dr. Shawn Riley, who is the medical director across the Metroplex for CareNow Urgent Care. We're talking about flu season, and this interview in its entirety, along with all of our others, are all on our podcast, The Human Side of Healthcare, and our YouTube channel under the same name. Steve?
Dr. Riley, I talk to people sometimes and they go, I'm not going to bother to get a flu shot. They have to guess every year what strain of the flu it's going to be. So it's kind of Russian roulette. What do you say to people that don't get a flu shot because they think it's a potential crapshoot, for lack of a better term?
Well, when you think about the flu and viruses in general, there's a thing called an antigen, which is basically the surface of that particular virus. Think of it as a Rubik's Cube, and sometimes it spins and the pattern looks different. And so that's the antigen, so to speak, that's going to be in your vaccine. Although flu can change a little bit over the season, it usually doesn't change enough to render the vaccine useless. And in this particular case, because we've modeled our vaccine off what happened in Australia about 6 months ago, the H3N2, and that is actually the predominant form of the flu that we're seeing in the U.S. today, the vaccine is remarkably effective against this year's seasonal flu. It also contains 3 other strains, just in case any of those 3 start to emerge. So really the best way to help avoid getting the flu this season is to get this season's flu vaccine.
You brought up an excellent point. By looking at the southern hemisphere and seeing what type of flu activity they're having, that influences how we develop the vaccines here. Did I hear that correctly?
That's correct.
Well, that's great to know. And that makes a lot of good sense as to why we should get our flu vaccine. I'm going to pivot just a little bit. I can only imagine for a physician, whether it's CareNow, emergency department, or a primary care provider, when someone presents with symptoms, how do you differentiate if it's COVID-19 or the flu?
Sometimes that's really tough from a clinical perspective because both of them are going to have a patient coming in with a fever and a cough. Now, it could just be another disease as well. It's not just the COVID and the flu that are out there during the cold and flu season, but we have things called rhinoviruses, enteroviruses, and particularly in children, RSV, or respiratory syncytial virus. So really, the best way to know the difference is to test. And that's exactly what we do in our clinics, is we have testing to determine if your symptoms of a fever and a cough happen to be the flu or the COVID or possibly the RSV. Really, the best way to find out what exactly you have if you're feeling sick is to go see the doctor.
Dr. Riley, this is Thomas. Do you have any thoughts on why these cases are popping up in the summer? And particularly, could that be related to that so many people have had COVID at one time or another to various degrees of severity? Could those be related?
There is some studies to suggest that there's a relation between, or an inverse relation between COVID infections and the seasonal flu. But when you take a look at the data, one of the probably more serious suggestions is that the cases begin to pop up during the summer, one, because of travel. It is a lot easier for us to go to the southern hemisphere where it's more prevalent. Once again, our summer is their winter. But also, too, since we have been practicing a lot of health hygiene measures over the last 2 years, people have become more susceptible to the seasonal flu. And so, therefore, it spreads a little bit easier. And then when people come back after traveling, unfortunately, they do tend to spread it.
People who have had COVID, is there damage in their lungs that might make them more susceptible to the flu going forward?
So that is a possibility, and it's really on a case-by-case basis, taking into account a particular individual's underlying, possibly chronic disease. Now, COVID can cause unusual severe disease in people who are otherwise young and healthy, and that was really true with the initial subvariants like the Alpha and the Delta. Now that we've moved into the Omicron part of the COVID, what we found is it's not quite as virulent as other strains. That is to say that it doesn't cause the same seriousness of disease, the same level of hospitalizations, the same level of mortality or death as you saw in the earlier variants. COVID can, especially in people who have a very severe form of the disease, one that required hospitalization, may continue to have symptoms long after COVID has resolved the acute phase. And we call that sometimes the long haulers. And apart from the other vague and neurologic symptoms that can exist with it, sometimes we do find, and you can see this actually on microscopy, changes in the actual lungs. And so those people can be a little bit more susceptible to catching any kind of respiratory illness. And that's why it's important to keep up with their pneumonia vaccines, their flu vaccines, and of course their COVID boosters.
So expectation question for a non-medical person. The design of these vaccines, especially these viral protections, the flu, the COVID, etc., is it now the intention to prevent or to lessen the impact, or both?
So the entire intention of a vaccine is to create the disease what we call subclinical. And so it does really both of the things that you just mentioned. One, it creates a robust immune response if a person gets exposed to a level of the virus, which would otherwise cause disease in somebody else who hasn't had the vaccine. And what that means is that your body kills the invading virus much more quickly before it can set up and actually cause the disease. Now, if it fails to do that for some reason, and it does start to create the disease, perhaps the immune response wasn't as robust for whatever reason, then it all helps to mitigate or ameliorate the level of severity of the disease, so it's not quite as intense and the symptoms don't last quite as long. And so somebody that's had, for example, the flu vaccine, they may not catch the flu at all if they've been in an elevator with somebody who's coughing and sneezing and has the flu, or if they do, it's going to be a very mild form of the disease.
We're talking with Dr. Shawn Riley here on the Human Side of Healthcare. He is the Regional Medical Director of CareNow Urgent Care in the Metroplex, and we're wrapping up our conversation about flu season. Steve?
Dr. Riley, I'm over age 50. I won't tell you how much older, but I'm definitely over age 50. And when I talk to my friends, they go, okay, Steve, I got to get a flu shot, got to get a pneumonia shot, got to get a shingle shot, got to get a COVID shot. You know, I'm just staying on the road all the time, just getting vaccinations. Can you get the flu vaccine at the same time you get other vaccines?
Absolutely. It's perfectly safe to do so. And then I'll remind you, too, that not only can you get those two vaccines together, and they're going to help to prevent both the flu and the COVID, but you can also get infected with both flu and COVID at the same time. Hence, it's a really good idea to make sure that you're up to date on both vaccines. And there is a term to the concurrent infection, something that we're a little bit concerned about as we're entering this new cold and flu season in 2022. Has been dubbed the twindemic. And the twindemic signifies that there's going to be both an increased prevalence of the COVID infections and also with the flu, and particularly a variant called the H3N2, which is what we saw in Australia about 6 months ago. And then when the CDC is performing a lot of their serotype tests, that is to say they're testing for what type of flu or subtype that's prevalent in the population, they've noticed that it is also the H3N2 variant. This particular year's flu vaccine actually contains that variant in it to help protect you against the specific type of flu that's going around. The other thing we worry about with the twindemic, though, is that we had a rather lackluster flu season over the last 2 years when it came to the kind of protective measures that we all enacted for COVID, such as social distancing, good hand washing, and of course wearing a mask. And that also leads to having a less than robust natural immunity to the flu, since many of us haven't caught it in a year or two.
You know, Dr. Riley, you've done a great job of answering questions on the flu, and I'm going to give you the last word. What message would you really like to leave with the listeners related to flu and prevention of the flu?
Absolutely. So the best way to help avoid catching the flu this season is to get your seasonal flu vaccine each and every season. And right now, it's the time to go ahead and get your flu shot. We offer those at CareNow, and we're available 7 days a week, extended hours. I would also say, too, don't forget to practice your usual health hygiene, which includes masking when appropriate. If you happen to be sick, we recommend that you don't go to congregate settings or be around other people, especially if you have a cough or a fever. Continue to wash your hands regularly, and if you have to sneeze or cough, practice good cough etiquette by coughing or sneezing into a disposable napkin and immediately throwing that away, and then sanitizing your hands afterwards.
Dr. Shawn Riley, who is the Regional Medical Director for CareNow Urgent Care across the Metroplex, thank you for your comments on flu and the flu vaccine this year. Next, Cathy Glenn rejoins us from Texas Health Dallas to talk about distracted driving. A person I knew and loved very much just passed from this very thing, and we'll talk about it next.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. Delighted you're with us today. And as we approach the holiday season, especially driving around North Texas in general, what about distracted drivers? We're going to talk to Cathy Glenn, who's the Injury Prevention Trauma Outreach Coordinator at Texas Health Presbyterian Hospital, Dallas. We've had Cathy on before. Welcome back, Cathy.
Thank you. I'm delighted to be here.
Cathy, we use the term distracted driver or being distracted. What is your definition of distracted driving?
Distracted driving is anything that takes your attention away from driving. For example, sending a text message, talking on a cell phone, using a navigation system, and eating or putting on makeup while driving. There are three main types of distraction. There is visual, where your eyes are off the road, manual, that is taking your hands off the wheel, and cognitive, which takes your mind off of driving. And actually, texting while driving is the most dangerous of distraction because it covers all three domains. And I'm not sure if people are aware, but answering a text while you're driving takes your attention away from the road for 5 seconds. And if you were to be traveling at 55 miles per hour, that is equivalent to traveling the length of a football field while blindfolded.
That really puts it in perspective. So if you take your eyes off of driving 5 seconds, it's equal to going 100 yards or more. That is unbelievable.
Yes, and distracted driving crashes are deadly because they are not paying attention to the road. And, most, like when we see that we're going to hit something, say maybe we didn't stop fast enough, someone was at a stoplight, in front of us, but we're able to put on our brakes and slow the car down some. But distracted drivers, many of them do not brake because they don't see, and so the crashes happen at higher speeds and they're deadly.
Our listeners are probably going, well, we know about distracted drivers, but the reason we're really exploring this, I want to ask you a question. In your role, especially in trauma and emergency, are we seeing an increase in driving accidents because the driver was distracted?
Yes, actually, in Texas, between 20 and 2021, crashes from distracted driving rose by 17%.
17% in roughly 1 year. That's unbelievable.
It is unbelievable. And I'm sure we've all driven down the road, and we can tell when people are on their phones. They're driving slower. The car is kind of drifting in its lane. I mean, it's very clear when someone has got their eyes off the road. It's kind of scary, actually.
So, Cathy, let me ask you this. You touched on cognitive, and I want to peel back that onion a little bit. I certainly understand if someone's talking on a cell phone, holding it in a hand while driving, that's very dangerous. What about a speakerphone? Are those safe?
I fought that one for years because that's a great way to talk to someone on the phone or listen to a podcast, but that is considered distracted driving.
So you're concentrating potentially more on the conversation you're having and may not be paying attention to the driving the way you should. Is that what you're saying?
Yes, and how that differs from having a conversation with a person in the car is that that person is like a second pair of eyes, and they might say, hey, watch out, and kind of, help you keep your attention. A podcast or someone talking on the speakerphone is that it doesn't have that.
Cathy, cars today, you can look in the rearview mirror and there's a little yellow flash if a car is coming up beside you on the right side or the left side. There are some that have nice backup cameras, etc. do you think we'll reach a point where if a driver's eyes veer from looking straight ahead, an alarm could go off?
I don't know the answer to that. I do know with cell phones, with each update, I think it makes it harder for the phone to operate while you're in motion. And as far as the new stuff on cars, I drive a 21-year-old car, and I wouldn't know. It's a Ford Expedition that has 323,000 miles on it.
Fair enough. So let me ask you this. What are your kind of golden rules for distracted drivers? What should they do?
That's a good question. I would start with our worst offenders of distracted driving, who are also our least experienced drivers, and that is our drivers from 15 to 21 years of age. There are some laws that help with our young people cut down on distraction, and there are consequences. In Texas, you cannot send or receive electronic messages while driving in Texas. Drivers with learner's permits are prohibited from using cell phones in the first 6 months of driving. Using any handheld device in your vehicle in a school zone is illegal, and drivers under the age of 18 are prohibited from using handheld devices. Now, for my own children, I would say don't multitask while driving, whether it's adjusting your mirrors, selecting music, eating, or making a phone call. Do it before or after your trip, not during. There are several apps for drivers that mute the phone while you're driving. It will, whatever incoming call is coming, it will send a text back saying, I'm driving and I can't get your call right now, but I will call you back. And for young people where their social group is so important and they would be afraid, oh my gosh, if I don't answer that call, they're going to think I'm mad at them or we won't be friends anymore. And so I think that design feature was truly made for young people, that if your best friend calls you and you're driving, the app on the phone will intercept that call, put it to your messages, and then send a text back saying, I'm driving, I will call you when I'm done. I think that's genius. If you are a passenger in a car with a distracted driver, ask the driver to focus on their driving. If you're a parent, talk to your teen or young adult about the rules and responsibilities involved in driving. Share stories and statistics related to teen and young adult drivers and distracted driving. Remind your teenagers that driving is a skill that requires the driver's full attention. Emphasize that text and phone calls can wait until arriving at a destination. Parents should familiarize themselves with our state's graduated driver licensing system and enforce its guidelines for your teen. And parents should know their state laws on distracted driving. Many states have novice driver provisions in their distracted driving laws. And talk to your teen about the consequences of distracted driving. Set consequences for distracted driving and set your family's rules of the road. Your family's rules of the road can be stricter than your state laws. And by all means, parents, set an example by keeping your eyes on the road and your hands on the wheel, and do not text and drive in front of your kids. Little eyes and little ears see everything we do.
So, Cathy, I got a couple of scenarios I'm going to run by you. People drive, but they only keep one hand on the wheel.
Yeah, I see people do it too. I think it's very important to keep two hands on the wheel. And we don't do it at 10 and 2 o'clock anymore. We do it at 9 and 3 or 8 and 4, because you never know what's going to happen around you. My daughter used to drive to Lubbock, to back and forth from Lubbock when she was going to Texas Tech out there. And deer would just run in front of the car, and she actually hit a few of them. But if for some reason you lose control of the car, you really need both hands to help keep that car under control.
So have you, in your experience, ever seen a bad outcome to this scenario? Two people are in the car, front seat. One just went through the drive-through, and as they continue to drive, says, hey, you take the wheel while I take a bite of this chicken nugget. What do you think about that?
I think that is very dangerous, very risky, and a horrible example to set for our kids. When you are leaning over from the passenger side and you are holding onto that wheel, you don't have access to the brake pedal, and also your point of view is different from if you're sitting right behind the steering wheel. I think it's very dangerous and should be avoided.
You know, when we think in terms of distracted drivers, we think, well, you hit another vehicle or you run off the road, but you could hit a pedestrian too. I'm sure you see that in the trauma units.
Yes. That does happen, and I won't be violating any HIPAA laws here, but I remember a crash that came to our hospital. The driver lost control of the car, she got distracted and hit and was in a work zone of all places. And to her horror, not only did she crash her car, but she hit the truck in front of her. There was a person standing there, a road worker, and she hit him and killed him. Her consequences just doubled. Not only was she injured herself, her car was totaled, but she killed someone. And not only did she kill someone in a protected road work area. And people should familiarize themselves with the laws about that, about when you're driving by when a police car has someone pulled off on the side of the road. I don't know if everybody knows that if you're going to maintain highway speeds, that you change lanes and keep going. But if you have to drive by them in the lane next to them, you have to slow down.
As we wrap up the next segment, I'll tell you the story about this young man who died, exactly what happened here that Cathy Glenn from Texas Health Resources is telling us about, and she'll be back to tell us more life and death safety tips on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're going to continue this important conversation with Cathy Glenn. She's the Trauma Prevention Outreach Coordinator at Texas Health Dallas. We're talking about something that's, I know. But 3 months ago, I lost a very dear friend that I'll tell you about at the end of the show to this very thing. And in the last segment, we were talking about that valuable real estate on the side of the road. And I learned something, Steve, actually coming out to your office one time. And I was on the toll road coming over there from Dallas. There was a highway patrol had somebody pulled over on the side of the road. And then the traffic going next to me was blocking me in where I couldn't move over. I was trapped in the inside lane. Well, I just went by. I wasn't speeding. But here comes a cop and pulls me over. Did you know that if you're in that situation and you can't move over, you are supposed to slow down 20 miles below the speed limit?
Yes, and they get really aggravated with people. I imagine he was aggravated with you, was he not?
No, he was nice, and I was nice, so he gave me a warning. I didn't get a ticket, but I didn't know that. I didn't know that you were supposed to slow down 20 miles an hour slower.
The side of the road is extremely dangerous. Cars are pulled over, or if police are getting out of their car and talking to the driver, that is a hugely dangerous area. In fact, recommendations are that you don't pull over to the side of the road any longer, unless your car dies or something and you can't roll it any farther. But if you're getting pulled over or you need to pull over, the recommendation is you pull off the freeway altogether. Because not only is that dangerous because you'll have distracted drivers, but particularly at night, drunk drivers follow the brake lights. And if you've got a car pulled over on the side of the road and you've got your brake lights on or your hazards, that drunk driver is going to think that's where the traffic's going. And many times they have run into people parked on the side of the road. It's very dangerous.
You know, cars are faster now, too, aren't they? They perform better. They brake faster, and they are faster. So many vehicles that are not expensive, European sports cars, will cruise 90, 95, and you think you're going 70. That makes it more dangerous in my book.
It does, because when you lose control of a car at that speed, so the car is traveling 90 miles an hour, you are traveling 90 miles an hour too. And so that's actually kinetic energy. That's the energy of motion. And so if that car runs into a concrete wall or another car and stops, that energy, that 90 miles an hour, has to go somewhere. And with our newer cars, it's designed to go in the crumple zones and the safety features of the car, the seat belts, the airbags, the crumple zones. But when the car stops, you're still going 90 miles an hour. So now you don't stop until you hit either the airbag, which is not the soft, comfy pillow that the commercials make it look like. That thing comes out like a fist, and it can break your glasses into your eye. Now you've stopped, but the organs in your body are still going 90 miles an hour, and they don't stop moving until they hit your ribs or the outside of your body. So when you think of organs, they are attached differently in our body, and so parts of them will move at different speeds. And that is why, like a liver will fracture, an aorta it'll dissect, meaning that it just breaks open. Intestines may pop like balloons. Lungs will pop like balloons. And so that's the third impact. The fourth one will be whatever you have in your car. If it's that toolbox, that gallon of milk you bought, that also gets launched and becomes a projectile in your car. And actually the most dangerous projectile in a car is an unsecured passenger. You think you're wedged there in the back seat and that you won't move, but an unsecured passenger will bounce around the inside of that car like a ping pong ball, and many crashes have been fatal because they had an unsecured passenger in there that bounced around and hit other people and killed everyone in the car.
So sad. There's another component that is prevalent today, anger. And it gets taken out at a flash, in an instant, particularly when somebody is in front of somebody who wants to go faster than they should be going.
Yes, road rage is a problem. I think that's also why people need to be very aware of what is going on behind them, around them. And I think if people obey traffic laws, it won't make road rage go away. But I just traveled to College Station this weekend for a class, and I was amazed at how many people drive slow in the passing lane. I could see people getting irritated. It doesn't excuse the behavior, but I think if people followed the traffic laws and, okay, get out of his way, then, I mean, it's not worth violence. I think if people were just a little more, let that crazy person go by you, let them go, let them get on their way and get out of your personal space.
I don't have much of a life, and I'll sit around and watch these dash cam videos now that you see on Facebook and YouTube, and you really get a sense for, so many of them are showing the scene, and you're watching because you know something's going to happen, and it makes you more alert to where the problem pops up, right? Well, one of the areas that I see the most, just like we talked about, cars going too fast, being too aggressive, they get out of control and they can't gain the control back. That's one. But the other is following too close. And then you end up in some kind of a rear end situation. People, for some reason, gravitate to a bumper. And they don't realize if they gravitate to my bumper and if they hit me, they are going to be sued. Because I got a camera on both ends of my car.
Yeah. I think people are angrier, more stressed. It doesn't take much. I think their coping skills are poor, or they're at the end of their ability to cope, and it doesn't take much to set them off. I think defensive, polite driving can help some, and I'll give an example. I believe in the obligatory wave of gratitude, that if someone is letting me merge in, I make sure they see that I do a little wave, and then the people that saw me merge in, I will slow down too and let people merge in front of me. I think if we just pay attention and we see a car that looks like it's wanting to get on its way, I'm all about letting them. That person's in a very heavy, fast car and might have a gun in the car, is probably bigger than me. Let them go. Get out of the way. And I think that's that's the smartest thing. And if you've got children in your car, I mean, you could see where the complexity of the situation would just spiral and get even worse.
We could wrap up with this, and it's a sad situation, but there are videos online of the 2021 100-car pileup in Fort Worth early that icy morning when trucks were literally jumping up over the concrete barricade in the HOV lane and other vehicles, and some of our hospital employees were in that pileup and were killed on their way to work that morning because people were going too fast.
Yes, I agree. And I know that sometimes Texas is probably like the laughingstock of people that live up in the Northeast and have grown up with that all their lives and don't understand how we have such a problem with it. But we do, and people don't understand it. Hey, this is different than what I'm used to. I should be slowing down.
This is Cathy Glenn that we've been listening to. She's the Injury Prevention Trauma Outreach Coordinator at Texas Health Dallas. 3 months ago, a young man I knew very well in my life for about a decade, just before his 20th birthday, was killed in a single-car accident when he went to grab for his phone, lost control of the vehicle, and hit a concrete wall. We want you and your family to have a safe holiday this season. Steve?
Thanks, Thomas. Enjoyed the show today. The 24th is upon us, so we hope all of you have a wonderful, safe Thanksgiving. And join us next week on the human side of healthcare.